Okay, we are live. Hello, everybody. Thanks for joining me this afternoon. I hope that you are staying safe. I hope that you're keeping well, and I'm bringing you greetings from home here in South Bend. It's a gray day in Indiana, but we got a magnolia right in the front yard that's blooming nicely and reminding us that spring really is coming and around the corner. And thankful for the blessings of being home and healthy at a time like this, and I hope the same is true for you. I'm really excited about the conversation we are about to have with Andy Slavitt. When this pandemic, this coronavirus emergency started to become clearly very serious, one of the first places that I found a reliable stream of steady, wide-ranging information online on social media was the Twitter feed that where Andy very efficiently puts out a daily flow of good information. He has also been part of a bipartisan team putting forward solutions, getting past the clutter, the noise, and cutting through the disinformation. He was formerly the head of the Centers for Medicare and Medicaid Services under President Obama. If you don't follow healthcare closely, that may not sound like much. This is an organization that processes about $1 trillion in funding a year. If it were a company, it'd be the biggest in the world. And with that expertise and that responsibility, he's a really important voice now in this conversation. He's also got a podcast called In the Bubble, which has a new episode coming out today with Tina Fey, something that both Chasten and I will enjoy. And so without further ado, I'm going to try to patch him in right now. Bear with me while I try to push the right buttons. And as soon as we get a request from Andy's side, we will be on. Just making sure. Andy, if you're out there, I'm looking for you on the request lists. Let's see, I can see you out there, but still need you to make a request to come in, or I may be making a mistake on my end. As you know, I'm not quite the master of Instagram Live that Chasten is, but let's see if we can bring this up. All right, we're just working through a quick technical issue. I see a lot of other folks kindly offering to be brought in live, but we're just looking for Andy right now. Bear with us, and it should come shortly. Just while we're waiting for Andy to patch in, I want to mention a couple other things that are going on. One, there's a great product out there called the research product called the Roadmap to Pandemic Resilience. It's another example of a group that has really worked across party lines to get good information out there. Encourage you to look to that as a resource. All right, let's try again. There you are. Okay. There we go. All right. Welcome aboard. Can you hear us all right?
It was like a 7-person job here to get me on, and I was not one of the 7.
We are all, I think,
Sorry about
refining our technological abilities here. I'm so glad to make time. I know that You must work incredible hours, judging by the moments when I see you weighing in on Twitter, passing along good information. Let me just first ask, are you taking care of yourself, and how do you organize your time, knowing that there is just an infinite amount of information worth absorbing and so many things to work on, but we're also only human. How do you think about being somebody who has so much to offer, but needs to take a
Well,
breather every now and then?
yeah, thanks for asking. I mean, I'm fortunate. You know, there are people who are displaced by this virus. There's people that are just disrupted. I'm clearly in the latter camp, and as a matter of fact, I've got we have a high school senior and a college senior, and they're both forced to be with their parents right now, which is great for us. But I would say I'd say of all the people they could spend time with, we're probably the bottom two on their list, and since right now we're the only two, we win. So it's really, it's really quite nice, for us to get to spend time with them. And then, I'm kind of, because I did the healthcare.gov turnaround, I'm probably better when there's a lot to do and a lot to coordinate. And because I've been inside government and been in the private sector, it's easier for me to see and connect things. And I think this is sort of something that I think is really appealed to me about your campaign is, if I've got the privilege to have a number of people that will just return my phone calls because I've met them, you can do two things with that, right? You can become an insider and use that for whatever thing you get out of being an insider, or you can use it to help people. And I get way more satisfaction out of doing that. So, my Twitter account is a lot of, if I hear something that people are like, this is what's really going on, there's zero expectation that if it's going to be helpful to people, that I'm going to sit on it in order to preserve some relationship that I don't really care about.
Well, I can tell you that I'm certainly grateful for the information that you're circulating, and glad you're getting it out there. Twitter's not usually a place I look to feel well informed and calm, but there's also something reassuring, even when it's not always good news, about what you have to share. There are a ton of questions that my followers have put forward that I want to ask you, but I'll start with one of my own. Recently, you and a number of others have put together a bipartisan strategy. Could you share a little bit about how that came about, and what are the things that most experts can agree on, even if there are some controversies,
Right,
some tug of war out there about what to do next?
right. I think, first of all, I think your premise is exactly right. There is way more. If there's not a time when we have stuff we can agree on, then I don't know when it will be. I mean, this is not like U.S. versus China, Democrats versus Republicans. This affects our species. So, I mean, never underestimate our ability to fight with each other. And for sure, the cable news and everybody else is going to focus on the 100 protesters and all that. I think that's fine. But the truth of the matter is, like, we could all sit here and wish we had a different president. And I probably think that the crisis would be going differently, right? But we are where we are. You have to navigate from where you are, not from where you wish you were. There's real lives on the line. And I think I don't know a person in the country that doesn't want to both A, save as many lives as possible, and B, get us back to normal life as soon as possible. And people can pretend like they're choosing between those things. But the truth of the matter is, so I think what we did is with Scott Gottlieb, who was a former commissioner in the Trump administration of the FDA, and a really solid, smart person, very nonpartisan. And the two of I have both done some Hill briefings together, and we've both been coordinating with both the White House and the Democrats and Republicans. We put together a letter with 16 people that included the scientist who cured smallpox, Larry Brilliant, included the guy who did all the work on contact tracing for HIV/AIDS, Michael Osterholm, some Republicans, some Democrats, all health policy people. And we hammered out an agreement on what we should be doing in the next phase. And the reason this is so important is because I feel like, and I'm sure all the rest of you feel like, we've kind of been playing this serially. Like, okay, let's everybody focus on masks. Okay, now let's everybody focus on vents. And let's everybody focus on testing. And we got to get ahead of this thing, right? I mean, we're chasing something that unchecked grows exponentially. So if you're always playing catch up and not thinking ahead, you're not going to get there. So what we tried to do is put together something that was a little bit more comprehensive. We hashed it out with people on, people who are in the civil liberties crowd. We hashed it out with people who are in the fiscally conservative crowd. We tried to hash it out with as many people as possible to put something together that would be sensible and passable. And essentially what it does is it tries to give resources to the states to allow them to turn what I think has been a big forest fire into small campfires. And by that, I mean, we're not going to eliminate COVID-19 until sometime in the future. What we can do, though, is make people feel safe again. And the way we make people safe again is to know that if there is an outbreak, that we'll be able to contain it, draw a circle around it, metaphorically put stones around the fire so it doesn't escape and get in the community spread again.
It's a great point that we've heard kind of one piece at a time of this, but we really need to be thinking several steps ahead, all the way through to when a vaccine is invented. Of course, that's not the end of our worries. That's the beginning of a massive challenge to make sure that information is out there. You mentioned being in touch with people who are concerned about civil liberties, and I know that's one question that was on the mind of a lot of followers. So one of the questions I want to put to you is, let me see if I want to make sure I credit the name of the one of the people who I've lost track of it on the list here, but I know there are quite a few followers who said this. So we know that contact tracing is important, right? If you test, you're positive. I want to try to find everybody you've been in touch with so we can warn them to make sure that they, in turn, get tested. How do we do that in a way that does honor America's commitment to civil liberties? Because the way this has been done maybe is going to look different in China or even a democratic country like South Korea. How can we make sure, both, first of all, that we're doing the right thing, and then secondly, politically, that more conservative or libertarian, or for that matter, progressive folks who are very concerned about liberties aren't worried about that step?
Right. Yeah. I mean, look, this is infectious disease meets liberal democracy. And I don't think we have to sacrifice one for the other. I do think it calls for intelligent people to have public discussion about these issues. And I'll tell you in a second that we did some actual polling through the Kaiser Family Foundation to understand where American starting point was on the issue. But I think I would say this way: if someone told me that I had COVID-19 and that I contacted it 3 days ago, I would want somebody to help me figure out all the people that I was in contact with over the last 3 days so that they wouldn't get sick or they could get tested. I think every American would want that. So if somebody told me that there is a systematic way to help make sure that I could do that, and I would be very interested in doing that. And as a country, if someone told me that by having the ability to do that, I could go back to work, I could go back about my life and feel much less risk, that would be very interesting to me as well. So those are the positives. On the other hand, like, who are the most distrusted people you can think of? Well, it's probably the federal government, Google, and insurance companies, right? So with people's imagination can, no matter what Google and Apple, and I talked to Google and Apple about getting together on this, no matter what they say, trust is a different thing than what the facts are. So they're setting up a technology system that could be helpful. But my view is, in the civil liberties question, a bare majority to 60% of people, it would answer positively to the question: would you use an application to track your whereabouts and so on and so forth? And a little higher when you tell people that there's a benefit, that they go back to work and so forth. But that's also a sizable minority, right, of people who wouldn't feel comfortable. And I think we ought to be a little bit at our peril to take 35-40% of people and tell them, no, you have to do something. You can do that in South Korea. It's more effective from a public health standpoint. I'm not sure you can do that here. So what that leads you to is something that you have to opt into as opposed to opt out of. So we've all seen these little boxes to click. Opt in means you're in automatically unless you get out. Opt out means that you are, that opt in is you have to make an active decision. And to make an active decision to opt into this technology renders it less effective, let's just say, because at a high end, 40% of people opt in. but it's not 40% of people that you get. You actually have to have both the person who is got the infection plus the person they're contacting.
That's right. It goes both ways. Huh?
So if I have it and I have the app and I was in contact with you and you don't have the app, it doesn't work. So it's actually, if you want to do the math, it's 40% times 40% at a high end, or about 16% effective. So our proposal actually calls for workers, like a healthcare workforce, or a core of people who would be professional folks who would help people through this process. And I think people feel a little bit safer about that question.
So let's talk about that a little bit, that human factor. And again, if folks are just joining, we're on with Andy Slavitt, who is a healthcare expert, led the Center for Medicaid and Medicare Services in the Obama administration, led the turnaround of healthcare.gov, and has emerged as one of the best, most thoughtful, and factual voices for information and solutions in the pandemic. So we've been talking about the subject of contact tracing. First of all, we got to make sure we have enough tests, more tests than we have today, so that people who, whether you have symptoms or not, we can figure out whether you have the infection or have had COVID-19. Then there's the challenge of making sure that we reach out and trace and contact anybody who might be exposed to somebody who's been tested. Part of that solution might rely on technology, but a lot of it is that human factor. And if I recall right from your research and the team you've been with, we're talking about six figures. We're talking about more than 100,000 people, ideally, who would be able to be quickly organized, staffed, trained, and equipped to go out and do this work. And it makes me think of other mass mobilizations in American history. Certainly there have been periods where we had to mobilize a lot of people in times of war. Also, every 10 years, America mobilizes a huge number of people who are called enumerators, who do the census work. For folks who don't respond right away by mail to the census, you got the clipboards, you're knocking on doors. I suppose campaigns do this too, political campaigns, right? You quickly spin up a huge number of people to do a particular task in a short amount of time. Can you talk a little bit about what it would be like to try to get that workforce you're talking about? Do you need to be an expert in public health? Does it take 2 years of education to qualify? Or could we hire somebody off the street, especially knowing how many people are hurting for jobs right now, and put them through a training for 5 days and then say, boom, you're one of the 100,000. And let me also, just before you respond, ask two other questions that are kind of attached to that. One, to get this many people online doing that work of contact tracing, first of all, what do you think it would cost? And secondly, could this idea be connected to the idea of national service? That was a very important thing in our
question.
An idea that I believe in, that I think has support from both sides of the aisle, especially in a moment when even our existing national service volunteers aren't being used, right? And so many AmeriCorps people, Peace Corps volunteers have had their projects canceled. So maybe you could connect some of the dots on that, the scale of this operation, what it's going to take, what we might learn from history, where we might find the people, where we might find the money, how much money we're talking, and whether any of this could work through the existing national service organizations that we have as a country.
Great questions, and they all have good answers. I mean, these can all be figured out. This isn't as hard as finding a vaccine, which, by the way, I'm not trying to imply is hard. It just takes smarter people than me to find it. This is something that we have experience with. We've done this with smallpox. We've done it with HIV. We've done this whenever we see an outbreak. We know how to do this, and that's, I think, really good news. We don't have to make it up. It's a little harder because it's a more infectious virus, so it means you need a little more work. So think of it this way: picture that there are a team of folks, maybe 3 or 4 people, and the person at the head of them might be an EIS officer or someone who has some training with epidemiological investigation. So kind of like a detective, and they have some pretty good experience. But then they need 3 or 4 people on their team, and those folks can be readily trained. And those are, I think, your analogy of an enumerator for census takers, pretty about as close as I can think of. And it's I'd say it's definitely skilled work, but it's work that, I mean, most people in America can do. The second thing you said, and we talked about this earlier, and I think it's a really great way to think about it, is people want to help. I mean, nothing worse than sitting home and feeling like there's nothing you can do about this invisible virus, right? So I think the idea of enlisting people and saying, hey, you're part of the solution. And by the way, I just want to remind everybody watching this, you are part of the solution. I mean, I
So how
can't
about
tell
that? I
you.
mean, a lot of folks are public spirited, action
Yeah,
oriented. Maybe not public health experts, but they're maybe would be the first to do so. I mean, one of the things I'm thinking about is I'm looking out my window at the river. We had some terrible river floods in the last couple of years. If the crisis at hand were a flood, we'd all be rushing down to the riverbank to
right.
fill sandbags. But
It's
often
great.
physically
Yeah.
gathering with other people is the one thing you can't do right now. So if somebody's following right now, watching, wants to be helpful, it's not obvious how. What are some of the things that you can do if
Well,
your instinct is to roll up your sleeves?
let's talk about the money. I mean, first of all, I mean, it's important to say it. Everybody who's been staying home and observing social distancing, you saved a lot of lives. I mean, it'll never be talked about because we won't know who. But just to give you an example, and the average, we know about 40 to 50% of people that have coronavirus are asymptomatic. So you don't know you have it. 80% of the time it's passed, people don't know where they've gotten it from. So people are out there as vectors without knowing it. So here's some simple, interesting math. If you are an asymptomatic person who was carrying the virus, and you went out and infected just the average number of people, and they each infected the average number of people, after 10 cycles, you've infected 4,100 people.
Well, just because one person made a
Just
decision.
one person made a decision to go out. So if you infect, instead of 2.3 people, 1.3 people, that 4,100 becomes 14.
Wow.
That's the power of exponential math. So people who have done that are real heroes, because at a case fatality rate, which is probably about 1%, that means 41 people died from those 4,100 people. And nobody did that on purpose. Nobody knew they did it. But that's 41 people's moms and dads. And so I think what the American public here rallied together and saved a whole bunch of lives. And I just have incredible admiration and confidence in our country that I think that we did this.
It's a great point. We're hearing the current estimate. I think about 60,000 lives lost, which is a horrible death toll over a period of time like that. But if effectively shutting down our country, that's what we did, and we still lost 60,000 lives. The numbers that we would be dealing with if we hadn't taken those dramatic steps are almost unthinkable, easily into six figures.
Right, and we're not out of the woods. But I say this, Pete. Here's how I think about it. We're going to lose people to COVID-19, and it's going to be sad. We're going to lose people. They're going to die of pneumonia, and it's going to be sad. But here's an important line, at least to me. If we lost an American because they couldn't get a ventilator or access to a nurse or a hospital, and we're dying in the hallway because we made the decision we couldn't treat them because we didn't have enough resources, that would be a whole nother matter. And that would be a very, very sad day for this country. And that's what would have happened if we hadn't, quote unquote, flattened the curve, because the hospitals would have just been overwhelmed. The math just doesn't work. As much as the heroics in New York and New Jersey and Michigan and Detroit were great, it couldn't have possibly happened otherwise. So I think that ought to be something we're committed to, and we ought to take that forward in how we think about healthcare coverage. Anyway, I'm getting on a soapbox here, but you had another question I want to make sure to answer, which was about how do we get the money? Did you want me to answer that? Yeah. So look, the states are going through incredibly difficult fiscal times. They don't have the money to hire the necessary people. And so what we proposed is a 3-part plan funded by Congress, where a state would come to the Congress, submit a plan on how many people they needed, and then they would get funding for 3 things. 1, to hire a workforce that they needed to do this work. Number 2, not everybody can self-isolate safely at home. A lot of people live in 1-bedroom apartments, live with grandparents, etc. So we would have $5 billion going towards vacant hotel and motel space, so people could comfortably self-isolate away from their family. And then the third piece is some income disruption replacement. The people who self-isolate are doing a civil service. This goes to your question about, this is your question about us versus South Korea or China, where they said, hey, you're going in this dormitory until you're better. What we're doing is actually saying, as an American who has got it infected, and you're willing to spend 2 weeks in this hotel, if you're missing work, particularly if you're living paycheck to paycheck, we got to pay you like we do when you do jury duty. You're doing a civil service. So we've gone to the Congress and asked for $45 billion, which is what it would cost. We think it's a drop in the bucket compared to not doing it. It's got bipartisan support. I hope.
Right. I mean, $45 billion sounds like a huge, unprecedented expense, but I mean, what's the cost of even 2 or 3 weeks of social distancing that could have been avoided, right? By doing this.
Yeah. Oh, $45 billion sounds like a lot of money in 2019 terms.
Things are different now. And,
yeah, right.
Well, I'm so glad that there are these specific steps being taken. Let me ask another question that came in from somebody that I think is really, I'm curious about, because I look to you as a good source of information. And so a user who I think is called Herbrand, or maybe Herbrand, wants to know what your 3 top online sources are for COVID-19 related data. Are there places you think are just good daily reads, or really reliable places to go to?
Yeah. So if you want the raw data, the Johns Hopkins site is great. There's a COVID data site which is good. It's pretty reliable. My wife just showed me a site that's, God, I'm gonna blank on the name of it, but it's like 1.3 acres. It's called COVID 1.3 acres. These are all sites that formulate and pull together the data. So, and look, honestly, the CDC is doing a better job now. But the truth is, we should be looking to the federal government. We shouldn't need to look at Johns Hopkins. We should see really transparent information coming on a daily basis out of the federal government, reported regularly, instead of like pick a fact that sounds kind of good today, pick a different fact that sounds kind of good tomorrow.
It's a great point. I hadn't thought about this, but I suppose in the same way that, in my view, we're seeing states and mayors playing a big role, partly because we haven't seen what we wish we had in terms of federal leadership. We're seeing we're all turning to nonprofit and university-based sources of information for things that you would like to be able to just get from a public source.
I'm gonna say this next comment and play for some hearts at the bottom here, which is I worked for President Obama. I know how we would have done things under President Obama would have been very fact-based. Here's my play for the hearts. Under President Pete Buttigieg, we can be really sure how you would be doing things. There would be very clear, specific information flowing to the public every day so that we could be all making better decisions. There's no reason why that has to be the case. I think Trump misjudges Americans, in my opinion. I think he thinks we can't handle bad news in a straight story. I think he thinks that he has to tell us something positive every day. But the truth is, if someone tells you the truth, and you don't have to deliver it in a horrible way, tells you what the path is, gives you a plan, but says, look, this is going to be hard and it's going to take a while, I think the public would be much more accepting of that than he understands.
Well, I think that's a big part of how you deliver trust over the long term, right? I mean, certainly for me, just in terms of people I've worked with closely, the ones who brought bad news to me with a straight face, told me the things I needed to hear, not just the things I wanted to hear. They were the ones where when they had good news, it was a lot more believable and earned that level of trust. Okay, here's another question, a hypothetical one, but one that I think is great, from Susanna. It says, imagine you got one day on the president's coronavirus task force. You are in the proverbial room where it happens. What do you do with that one day?
I probably appoint Ron Klein to be the head of the task force full time, and I know all the things that he would stand up. But
Ron Klein, by the way, is somebody who has Indiana roots and played a magnificent role in helping get ahead of the Ebola pandemic.
Right.
Or the Ebola outbreak, I should say.
Right.
Did not become a pandemic.
I was there at the time. And, I would say, to be fair, the Obama administration was in year 6, 7, 8, so they were humming more. But with Dennis McDonough, Ron Klein, there was one word, things operated incredibly efficiently. You knew what was going on at all times. And, what we have in this situation requires the willingness of the federal government to take some accountability. And I know that means that, and the reason I think we all know the reason the president does that is he wants to be around in the end zone for all the good stuff, and he doesn't want to be held accountable for things that don't go badly. And I say this, and I know that sounds critical of the president, but I think it's an issue we need to hold him accountable for, because it leads us to bad decisions. It leads us to putting imperfect information out there. And if I were in there for one day, I would say, look, the way we engage everybody in solving this problem is putting all the right information out there with a single point of control and leadership. And to me, that's Ron Klein.
So much depends on who's in those key positions. And I think, unfortunately, we've learned the hard way just how important government is. When I think some of the folks leading government just don't believe it. And I don't mean for that to be a partisan statement. Of course, I'm a strong Democrat. You served in a Democratic administration. But this does get me to an interesting question that came from, I'm not even going to try to pronounce this handle, but the question is great. How can we break through the idea that all the criticism of Trump's failed response is partisan? And I think this is especially important because I know you're in touch with a lot of prominent Republicans as well as Democrats. Some of them may say things in private that they don't feel that they are able to say in public. But you shouldn't have to be on one side of the aisle to be able to point to the problems in this response and to be able to call for something better. How do we make sure this doesn't turn into a partisan issue when this is really about keeping us safe and the virus doesn't care if you're a Democrat or Republican?
And I hear that question two ways. I hear, how do we avoid the partisanship? I also hear how do we hold the president accountable to make it clear where he's making mistakes, but in a way that doesn't sound political. And I think that's a tricky question. I mean, I start with this, like, as much as over the last 3.5 years, I've had a hard time believing that the president and I believe any of the same things. It's just simply not true. It's just simply not true. The president doesn't want people to die, right? The president wants the economy back on his head. We want the same things. And as I think you said earlier, you have to navigate from where you are, not from where you wish you were. And so Democrats reaching out, as I've done and many, many others have done, and to say, we're here to help, we're on the same team, it gives them a psychological boost, believe it or not, because it's a hard job. There's no getting an A in pandemics. It's impossible because you're
no matter who's in charge. This would be a colossal challenge.
It's huge. It's hard,
even for the best people ever to serve in government.
It's hard, but it's not hard to get a B, as what David Frum has actually told me. That he's like, getting a B is easy, because getting a B is just about leveling with people and being honest and not letting your baser instincts, drive things. So the way I've tried to ride this fine line is to say, look, if you want my help, you want my participation, you want my support, you got it. Call me anytime. I'll send, my ideas to you. But here's just a couple of stipulations. One is, I'm not sharing anything with you that I'm not going to share publicly. And secondly, the price of this is that I will hold you accountable when you're not doing what I think you need to do. Now, this isn't me talking to the president directly. This is me talking to one of the senior people. And I said, Jim, that's just going to happen. So when you say, forget about the freaking Lysol thing, but when you say things that are destructive, then I'm gonna call it out publicly. And if that's not an okay deal, then forget it. Then I just can't do it. But I think there's an analogy for all the rest of us here, which is to say, root for all the things that make life better. Like, we can get caught up in the Georgia thing right now, right? Which is, we can say, Kemp's an idiot and he's going too fast and all this. But the truth is, I hope, and my wife said this to me this morning, and she's a very partisan person, I hope it works, Georgia. I mean, it's like we shouldn't be in a frame where we kind of wish that, why be right? There's no juice in being right here.
Right, we definitely wish we're wrong when we're alarmed about some of these things that are happening, right?
The number one thing
since you mentioned the opening that's going on, and it's clearly happening in so many different patterns in different places. Here in Indiana, we're waiting on the governor tomorrow to indicate whether the stay-at-home order will extend or not. But in Indianapolis, the mayor has indicated that they're going to proceed to continue no matter what for a couple of weeks. A relatively healthy relationship there where I don't think they view that as a confrontation. They're just saying, hey, here's what works for our city.
Right.
I'm much more concerned in places like Georgia, where it seems that mayors are being overruled, and even if they try to do something different or go a little further, they're getting that pushback. But one of the questions that Eric asked was, when do you expect that we see a second wave? Somebody else, Nikki, who lives in Georgia, says, how will we actually know when it's safe to reopen things? I live in Georgia and don't trust our governor. So in the context of, and I don't mean to draw you into predictions that maybe are too hard to make, but as we see some partial reopening happening, and it's happening to different levels and it's happening in different places, what are the most likely scenarios? And knowing that, to take your earlier example about exponential math, we could have this thing kind of 99% conquered and then let our guard down, and it could be as bad or worse as it's been on its worst day. But we wouldn't know for a few weeks or months. How should we think about what to look out for, what to be afraid of, and what to hope for in the next few days and next few weeks as some of this opening takes place?
Yeah, it's a great question. I mean, look, let's start with the truth. There's a lot more we don't know than we do know, and it goes a little bit to your source question. Is if you don't have a source for information that doesn't frequently say we don't know, get a new source, because we are filling in a lot of holes. And imagine 10 years from now, we'll be looking back at this, and there'd be a whole lot of things we know that we thought we knew today. I called the head chief intern at the San Francisco General Hospital from 1983, and asked him in 1983, what did they think they knew about AIDS, and what turned out to be true and what turned out not to be true. And he said we had it figured out pretty quickly, like within a year or two. Right? We're in 6 weeks, right? So I think, and people are doing the best they can with maze of facts they're trying to put together. Now, I think, and there's a wide disagreement. I mean, among experts, about what happens. So I think in a situation like this, it turns out that I don't think the politicians, whether it's the governor or the president, are really going to be the ones that dictate what Americans do. I think Americans will, quote unquote, open up as soon as they feel safe doing it. So, I don't see people in Georgia jumping into the street and start sharing popsicles tomorrow. I think what happens is, what does it take for the economy to open up? It takes consumers feeling comfortable spending. It takes businesses feeling comfortable hiring. It takes small businesses feeling comfortable opening up. And I think there's a threshold for them to get there. And for them to get there, again, it's not the elimination of COVID-19, but it's a sense that, boy, if there is an outbreak, we can contain it. And number two, it's that the really high-risk people, and we know who many of the high-risk people are, older people with chronic conditions. There's still a lot of mysteries, though, to be fair, that those folks can be protected. Right. I think, and so I would call it, to use an analogy, you can tell me if it's a bad military analogy, Pete, or not, but to me, it's conditions on the ground based, not date based. So it's like saying we're pulling out of Afghanistan July 1st, instead of saying we're pulling out of Afghanistan when we've met the following conditions on the ground. And so Trump has trapped himself in this, okay, it's going to be Easter. Okay, it's going to be May 1st. Okay, it's going to be, now Penn says it's going to be Memorial Day. The reality is, it gives the wrong impression. It gives the impression that there's going to be a flip the switch, as opposed to a gradual sense of comfort at certain activities. And it won't be all activities. Like, it won't be, Trump says he's going to have a full football stadium for the next Alabama football game. It doesn't sound smart to me. But, that's... Especially
because each time that it doesn't happen as planned, the credibility falls, right?
Right.
I know we're coming up on our time, but there's one more question that I think is great, and I'd be curious what you've seen that might answer this. It comes from Anna Pitts. She says, how do we explain this complicated information to our kids? Is there a kid-friendly explanation somewhere? And I think that's a great question, because kids may or may not even understand what's happening. They know that their lives have changed. They don't necessarily know why. It's frightening as well as disruptive. What are the best places to go to find ways to talk to kids about this?
So I have not to plug it, but I have a special episode on Sunday on my podcast where I've taken questions from kids 4 to 14.
Okay.
And I've already recorded it.
And your podcast again is called
In the Bubble with Andy Slavitt. Most recent episode was Tina Fey, but
we're excited for the Tina Fey one.
That was fun.
We had a big fan, and so am I.
Oh, good. We had we had Nate Silver on. We had Anthony Scaramucci, Mark Cuban. Pretty interesting set of guests, but it really is attempted to give people straight information. But it's interesting, and it doesn't freak people. It's sort of the anti-Chiron of podcasts. We describe it as 50% Winston Churchill, 50% Fred Rogers. So that's kind of the vibe we're going for. But we did an episode with where we just had a bunch of kids ask us questions, and they are amazing questions. And guess what? They're exactly the same questions we have. When can I go back to school? When can I play with my friends? And then there's some stuff that we wouldn't ask, but we because we're too grown up. Is this the worst thing that's ever happened? Or what's the worst thing that can happen? Things that grown-ups are God, I'd like to know that too. And it was really fun. We're posting it on Sunday for parents and kids. There have been other things too. CNN and Sesame Street did a special together. There are lots of good source materials that I can probably find, and we can give you the link to folks that are how to talk about it. I'm sure there's a podcast specially dedicated to kids and COVID-19 because there's a podcast for every other thing.
That's great to hear, and thanks for. We'll keep an eye out for that on Sunday, and thanks for taking that step, because I think not everybody would think to do that. And yet, parenting is one of the things that's of course changing just as quickly as
it's funny
as governing campaigning.
One kid asked me, "Is there anything I can eat that would give me immunity?" And I'm like, "Yeah, pizza." He's like, "I love pizza. Advice, I love pizza." I'm like, "Why not? It can't. How can it hurt?"
Well, I want to thank you again for taking the time. We're here with Andy Slavitt, healthcare expert, policy expert, who has, I think, become a really important source for thoughtful and factual information. I know you're burning the candle at both ends, so I thank you for committing some time, and we'll keep an eye out for the podcast and your Twitter feed and other good sources of information, hoping that we all pull through this as safely as possible, and just thankful for fact-based commentary out there. Thanks again.
Thanks for having me on, and give our best to Jason.
Will do. Thanks so much. Take care and be safe.
You too.
All right. Well, hopefully you see why I thought it was so valuable to take some time to speak with him. Somebody who's just a good source of information that certainly I trust and always look to learn from. There's a lot of nonsense out there, and there's a lot of noise. But the truth is, most of that's coming from the fringes, and the vast majority of Americans understand that this is extremely serious and are looking for ways to support one another in getting through this. And I think it's ultimately up to us whether America is going to come out of this stronger and better than we were before, or whether we're going to allow this to really take advantage of and worsen our weaknesses as a country. I tell you what side I'm rooting for, and we'll continue to do what I can to elevate voices that I think are making a difference and that deserve our attention. So thanks for taking some time. Again, I hope that you're keeping safe. Thanks, by the way, for the fantastic questions. And we only were able to get to a handful of them, but every time I put a question out to our followers, we get such thoughtful and smart questions that they get me thinking too. So thanks so much. I will see you before long, and hope that you all are keeping safe. Take care.